Let me ask you something before we begin. When you woke up this morning, did you feel a strange stiffness in your neck? A dull ache behind your eyes? Maybe your fingers felt a little numb, or your balance was off when you first stood up? If you said yes to any of that, I need you to stay with me for the next few minutes, because what I'm about to tell you could quite literally save your life. My name is Dr. Ray, and in over 20 years of treating senior patients, I've seen something so common, so ordinary, so completely overlooked that it's become one of the silent killers hiding in plain sight in almost every bedroom in this country. And the shocking part? It's not a medication. It's not a food. It's not even a disease. It's your pillow. Yes, you heard me correctly. The very pillow you rest your head on every single night could be setting you up for a morning stroke. And most seniors have absolutely no idea. Now, before you roll your eyes and think this sounds dramatic, let me explain exactly what's happening while you sleep. Because once you understand the science, you'll never look at your pillow the same way again. You see, when you lie down at night, your body goes through a remarkable process. Your heart rate slows, your blood pressure naturally dips, your breathing becomes deeper and more rhythmic. But here's what most people don't realize. The position of your head and neck during those 7 or 8 hours of sleep has a direct and powerful effect on the blood flow going to your brain. The arteries in your neck, particularly the carotid and vertebral arteries, are the highways that carry oxygen-rich blood up to your brain. And when your pillow is too high, too low, too soft, or too firm, those highways get kinked, they get compressed, they get twisted. And for a senior whose arteries are already narrowed from years of life, that compression can be the final push that tips the balance toward a stroke. I remember a patient of mine, a wonderful gentleman named Harold, 72 years old, active, sharp, still walking 2 miles a day. He came into my office one morning with his daughter, and he told me he'd been waking up with headaches, blurry vision, and a tingling sensation down his left arm. He thought it was just getting old. His daughter thought it was stress. I ran every test I could think of. His heart was strong, his cholesterol was manageable, his blood pressure was controlled. But when I asked him about his sleep, he mentioned something almost in passing. He said, "You know, Doc, I've been using this big, thick pillow my wife bought me years ago. It props my head up nice and high. I like it that way." That one sentence changed everything. I had him switch his pillow that very week, and within 10 days, the headaches were gone. The tingling disappeared. His morning vision cleared up. Harold didn't know it, but he had been slowly strangling the blood supply to his brain, night after night, for years. And Harold is not unusual. He is the rule, not the exception. Study after study has shown that improper neck alignment during sleep reduces blood flow to the brain by as much as 30% in some positions. 30%. Think about that. Imagine if someone told you that for 8 hours every night, nearly a third of the oxygen your brain needs was being cut off. Would you be surprised that seniors who sleep this way are at higher risk of transient ischemic attacks, mini-strokes, and full-blown cerebrovascular events in the early morning hours? Because that's exactly when most strokes happen, between 4 in the morning and 10 in the morning, that window. That's when the damage shows itself. And the pillow you've been loyal to for 15 or 20 years might be the very thing setting the stage. Now let me tell you the specific mistakes I see seniors making over and over again, so you can check your own pillow tonight and know if you're in danger. The first mistake, and by far the most common, is using a pillow that's too high. I'm talking about those big, plush, overstuffed pillows that feel like a cloud when you first lie down. They feel luxurious. They feel supportive. But what they're actually doing is forcing your chin down toward your chest, bending your neck at an unnatural angle, and pinching the arteries along the back of your neck. If you wake up with a stiff neck almost every morning, your pillow is too high. If you feel like you need to stretch your neck as soon as you stand up, your pillow is too high. If your partner has ever told you that your chin touches your chest when you sleep, your pillow is absolutely too high. And I'm begging you, please replace it this week. The second mistake is the opposite problem. A pillow that's too flat, too old, too worn out. Many seniors keep the same pillow for 10, 15, even 20 years. They flatten down, they lose their shape, They stop providing any real support. And when your head sinks too low, your neck tilts backward, and this also compresses the vertebral arteries at the base of your skull. A good pillow should fill the natural curve between your shoulder and your head, keeping your spine in a straight line from your tailbone all the way up to the top of your head. If you can see a bend in your neck when you look at yourself lying down in a mirror, your pillow is wrong. The third mistake, and this one surprises almost everyone, is sleeping with two pillows stacked on top of each other. I see this constantly with seniors who have acid reflux, breathing issues, or just got used to it over the years. But stacking pillows is one of the worst things you can do for the blood supply to your brain. It creates what we doctors call a chin-to-chest compression, and over hours and hours of sleep, it can reduce cerebral blood flow dramatically. If you need to sleep elevated because of reflux or breathing problems, you should be elevating your entire upper body from the waist up, not just propping your head forward on two pillows. There are wedge pillows designed specifically for this purpose, and they are infinitely safer for your heart and your brain. The fourth mistake is using the wrong pillow for your sleeping position. If you sleep on your back, you need a medium thickness pillow that supports the natural curve of your neck without pushing your head forward. If you sleep on your side, you need a thicker, firmer pillow that fills the space between your ear and your shoulder, keeping your spine straight. If you sleep on your stomach, I have to tell you honestly, this is the most dangerous position for seniors. And you should really try to train yourself out of it because it forces your head to turn sharply to one side for hours, which can seriously compromise blood flow and nerve function in your neck. But if you absolutely must sleep on your stomach, use the thinnest pillow possible, or no pillow at all. The fifth mistake is ignoring the material your pillow is made of. Old feather pillows that have clumped together, memory foam pillows that have gone hard with age, synthetic fillings that have lost their bounce. These materials can force your head into awkward positions and create pressure points that restrict blood flow. A pillow should be firm enough to support you, but responsive enough to adjust when you turn your head. If you press down on your pillow and it doesn't spring back within a few seconds, it's time to replace it. Now you might be sitting there thinking, Dr. Ray, is this really that serious? Is a pillow really going to cause a stroke? And I want to answer that honestly. A pillow alone for a healthy 40-year-old is probably not going to cause a stroke. But for a senior over 60, whose arteries have already accumulated some plaque, whose blood pressure may already be elevated, whose circulation isn't quite what it used to be, that compressed artery for 8 hours a night can absolutely be the tipping point. It can be the difference between waking up refreshed and waking up with slurred speech, a drooping face, and a frightened spouse calling an ambulance. I have seen it too many times to pretend otherwise. And there's something else I want you to understand. The warning signs are almost always there before the stroke hits. Your body tries to tell you. But because these signs happen first thing in the morning, people dismiss them. They blame them on old age. They blame them on a bad night's sleep. They blame them on the weather. Please listen to me carefully. If you wake up with numbness in your hands or fingers that takes more than a few minutes to go away. If you wake up with blurry or double vision that clears after you sit up. If you wake up with a headache that's different from your usual headaches. If you feel dizzy, off balance, or confused for the first few minutes after getting out of bed. If your neck feels stiff in a way that feels wrong, not just sore. Any of these symptoms happening consistently in the morning are red flags that your brain is not getting the blood flow it needs during the night. And the very first thing you should examine is your pillow. Let me tell you what to do about this starting tonight. First, take your current pillow and really look at it. Hold it up. Is it lumpy? Does it hold its shape when you squeeze it? Has it turned yellow? Does it smell? If any of those are true, that pillow needs to go in the trash this week. Second, measure yourself. When you lie on your back with your head on the pillow, your chin should be level with your forehead. Not tilted up, not tilted down. Level. If it's not, the pillow height is wrong. When you lie on your side, your nose should be in a straight line with the center of your chest. If your head is tilted up toward the ceiling or down toward the mattress, the pillow is wrong. Third, go buy a new pillow that's designed for your specific sleeping position. There are pillows made specifically for back sleepers, side sleepers, and for people who switch between positions. You don't need to spend hundreds of dollars. A good supportive pillow can be found for $30 or $40. But please, do not keep sleeping on something that's slowly putting you at risk. And one more thing I want to share with you, because I think it's important. Many seniors develop certain sleep habits over decades and they become deeply attached to them. I understand that. Change is hard, especially when you're in your 60s, 70s, or 80s. But the research is very clear. Seniors who sleep with their neck properly aligned have lower rates of morning cardiovascular events, fewer headaches, better cognitive function, and even better memory consolidation. Your brain does critical repair work during sleep. It clears out waste products, it strengthens memories, it regulates hormones, and it can only do that work if it's getting enough oxygen. Your pillow is either helping that process or sabotaging it. There is no middle ground. I also want to mention something that often gets overlooked. The temperature of your pillow and your sleeping environment matters more than you might think. An overheated head can cause the blood vessels in your scalp and brain to behave abnormally, and combined with a bad pillow position, this doubles the risk of poor circulation. If you're waking up sweating, or if your pillow feels hot when you flip it over, consider a cooling pillow or a breathable pillowcase made of cotton or bamboo. Small changes like this add up over the course of a night. And please, 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 if you're someone who snores heavily, who gasps during sleep, who wakes up feeling like you didn't breathe well, you need to talk to your doctor about sleep apnea. Sleep apnea combined with a bad pillow is a dangerous combination, and it's one of the biggest predictors of morning stroke in seniors. A sleep study is painless, usually covered by insurance, and can reveal things about your nighttime health that you'd never know otherwise. I know I've shared a lot with you in the last few minutes, but I want you to walk away with 3 simple actions you can take today. Number 1, check your pillow tonight when you lie down and see if your neck is in a neutral position. Number 2, if your pillow is older than 2 years, if it's lumpy, if it's flat, or if it's too high, replace it this week. And number 3, pay attention to how you feel in the first 10 minutes after waking up for the next 7 days. Write it down if you need to. Are you dizzy, numb, headachy, stiff in a strange way? These clues are your body speaking to you, and it's time you listened. Remember, a stroke doesn't happen out of nowhere. It builds up over time, night after night, day after day, through dozens of small decisions that either protect your health or slowly chip away at it. Your pillow is one of those decisions. You make it every single night, whether you realize it or not. And now that you know what you know, you have the power to choose differently starting tonight. If this information was helpful to you, I want you to do 2 things for me. First, share this video with someone you love who's over 60, a parent, a spouse, a sibling, a friend. This could be the warning that saves their life. And second, subscribe to this channel and hit that bell icon, because I release new videos every week with the kind of information that most doctors don't have time to explain in a 15-minute office visit. I want to be here for you, to give you the truth, to help you live longer, healthier, and stronger in your golden years. Before I go, I have to give you my standard reminder, and I say this because I care about you. Everything I've shared with you today is for educational purposes. I am not your personal doctor. I don't know your full medical history, your current medications, or your specific health conditions. Please, before you make any major changes based on what I've said, have a conversation with your own physician. If you're experiencing any symptoms that concern you, especially symptoms that could suggest a stroke or mini-stroke, do not wait. Do not assume it's just a pillow problem. Get medical attention immediately. Your life is worth more than any assumption. Take care of yourself. Take care of your neck. Take care of the people you love. And I'll see you in the next video.